part first, okay? So put your books down. I'm going to have you guys set up in pairs, please. Okay, so Sean, what is the first thing that you are going to do?
Check the scene, make sure it's safe to approach.
Does it look safe to you?
Fairly, yeah.
Okay, I think it looks safe to me too. All right, what's next?
Tap and shout.
Okay.
Hey man, you all right? Can you hear me?
Not responding to you.
Nothing.
What else am I checking?
I'm looking for his chest to rise and fall.
He's not breathing.
Signs of breathing.
No.
Andrew, I need you to call 911. All right, he's gone.
He's guffed.
All right.
Okay, go ahead.
Start with the compression.
Yep. So very awesome. You guys did all of the compressions very well. Okay, did anyone have any questions on that part? So the first part of I walk in, my room is safe, I check him, I have no more than 10 seconds, I'm going to check him. I'm also checking to see if he's breathing at that same time. Then I call for help by activating the emergency response system, and then I start with my chest compressions. No questions? Okay. So the next thing we have to do is we need to give this guy some air. He's not breathing on his own. So to do that, we have what we call a pocket mask. Okay, everyone should have a pocket mask. Okay, so notice that there's kind of a teardrop type shape to the pocket mask, and if you flip it over, it actually says nose on the top. Okay, so that part goes over their nose. So when you put it down, the smaller end should be over their nose versus if you had it upside down where it was pointing down towards their chest. So you want it pointing up towards the sky or up towards their head. Then what you're going to do is you're going to take your hands and you're going to make kind of like some C's with your fingers there. You want to put some gentle pressure. Okay, you don't need to mash it into his face, but just gentle pressure. Okay, and then we need to tilt his head. It's called a head tilt chin lift. That opens his airway, so his tongue isn't sitting in the way. Okay, so to do that, I'm using these 3 fingers to kind of lift up on the bony part. So right here on the edge here where your jaw is versus right in the middle where your tongue is, on the bony part. And I'm using this hand's palm on the forehead. So this is what it looks like. Can you guys all see his head okay? Okay, so I put the mask down with the pointy part towards his eyes. I make my C's, I put those down. I'm going to use these 3 fingers over here on the bony part of his jaw. This palm is on his forehead, and I'm going to tilt his head. Then I need to give him 2 breaths. I just need to see his chest rise and fall. I don't need to blow him up like a balloon. Okay, so 2 breaths. Help if the valve is closed. Did you see his chest rise? Okay, 1 more breath. Did you see it rise? Okay, that's it. I gave 2 breaths. You have 10 seconds or less to give 2 breaths. Should be plenty of time. Now, when you first do it, it's going to seem difficult. But with the more practice, you guys will get used to being able to do it. You should be able to do it with no problem in 10 seconds, giving 2 breaths. Notice, I didn't blow his chest up so it got really, really huge and he looked like he was this big, right? No, Andrew? No, okay. I just needed to see his chest rise a little bit. When I see chest rise, I know he got enough air. Notice I also gave the breaths over about 1 second. So I didn't blow like I'm the big bad wolf. I didn't, okay? You just need to blow kind of a gentle pressure until you see the chest rise, and then you can stop, okay? Now obviously, same on the reverse side, if I just went like I'm trying to gently blow on something, that's not gonna make his chest rise and fall. Okay, so we're going to practice giving 2 breaths. So, and if you want the green strap here, you can actually wrap around their head and then pull. Yep. So it helps with the pressure and helps so it doesn't fly away when you go to do chest compressions.
Okay.
Okay. All right. So make your gentle pressure down, and then we're going to tilt the head, and then deliver 2 breaths. And see if you can get chest rise and fall there.
Now you're supposed
You should be able to, yep, you should be able to see a little bit of something right in the middle there if you get good chest rise and fall.
I'm not getting a good seal on this guy.
Okay. It's a little difficult, so. You feel air escaping there?
Right up near the-
So just keep trying until you can feel that you're getting good pressure all around.
See anything?
Let's see, do it again. Yep.
Bells off.
I can see yours.
A little bit?
Yep, a little bit. So, Sean, instead of, you see how you're kind of pinching with your hand? Instead of pinching, yeah, try more of like I said, soft downward
Okay.
pressure. Sometimes pinching, what you end up doing is creating these little pockets where the air can escape, versus if you press straight down, you're less likely to have
Okay.
that happen.
Right.
And you'll hear them exhale.
Hear that. Okay.
It'll be kind of similar, and you'll see the chest rise and fall more. These, it's a little harder to see the chest rise and fall, but you'll definitely see the chest rise and fall. Okay. If you don't see the chest rise and fall, then you can consider that it probably didn't work. There is something called hands-only CPR that you can do. Okay, hands-only CPR, you wouldn't give breaths. You would just do the compressions. Okay, now the downside of just doing compressions, remember we used to stop at 30? With hands-only CPR, you're not going to stop at 30. You're just going to keep going. So remember that rate of at least 100 per minute? You got to keep going at least 100 per minute. So I come into the room, scan my room, look safe. I don't see anything that's going to hurt me. Okay, I'm going to approach the patient. I'm going to check him out. Hey, are you okay? Are you okay? Are you okay? He doesn't seem to be responding. I'm looking to see if he's breathing. Doesn't seem to be breathing. So, Sean, can you call 911 and get me an AED? Okay, he left. So now I'm going to go ahead and start my compressions. Lower half of the breastbone. I'm going to interlock my fingers there. I'm going to give 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay? I'm going to give him his 2 breaths. Remember, tilt his head. And then I'd go right back into 30 compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 9, 30. 2 breaths. And I'm just going to keep going back and forth. 32, 32, 32. Make sense? Until he comes back with the AED, or somebody with medical training comes, so an EMT, a paramedic, a firefighter, maybe even a policeman, and takes over for me. Okay? Or maybe he, wakes up and is like, stop, quit it, stop, quit it, ow, quit it. Okay? If he says, ow, quit it, you can stop. He's fine. Okay? Any questions with that? So that's the normal way we would do it. That's with including if we give them the air. Now if we want to do hands only, it's almost exactly the same, except I'm not going to stop to give air. So I scan my room is safe. I'm going to check him. Hey buddy, are you okay? Are you okay? Hey, are you okay? Doesn't seem to be responding.